I think telemedicine is here to stay. I think we've done a huge job in not only saving money, but also relieving stress and preventing additional costs for the healthcare system.
Dr. Dercksen, what was the defining moment for you to integrate Avy Health into your own medical practice?
When I found that the medical office assistants were so quick to follow up on patients that were really ill. On a Sunday, I had a patient that needed urgent care, and within 2 hours, I had the medical office assistant contacting the patient and arranging for the patients to go to the emergency room.
Wow, that's amazing. Are there any other stories that you feel were sort of life-defining for the patient?
I have found that the patients that have come to me had said that they have received such great care that they feel their lives have actually been changed in even short amount of time. These are patients that have had quite significant problems. So I felt that my patients that I'm seeing are safe and comfortable, and so I felt good and ready to shift my practice solely into Avy Health.
Dr. Dercksen, walk us through a typical shift on the Avy platform from your perspective.
My hours are very flexible, so I can choose whatever hours I start. And I would book patients and see patients from the morning through to the afternoons. And I will see patients around 10 minutes a patient, and then be able to manage these patients for a number of hours in the day.
How does the workflow compare to a regular clinic?
Pretty much the same, except that I'm on the phone rather than seeing patients in person, and that it is very flexible for the patients that can access me even when they're at work. They'll just hop off to a quiet space, and then they'll be able to go back to work.
So to reassure patients about a virtual setting, what would you say to them to reassure them that it's just fine?
I would say that because most of our information about health comes from what the patients are telling us, the histories, that makes it very important that we have good communication, and that if the patients can share their stories with us and we can listen to the patients, then most of the time we can manage specialist referrals, lab investigations, x-rays, and do almost all the work that the doctors can do in person.
What was the most surprising or rewarding aspect of treating patients virtually that you didn't expect before you joined Avy?
I actually didn't expect Avy to be so flexible with some requests that I've had. And what has made me very happy with Avy is that they're actually willing to go outside the box. And we're busy now working on different pain projects so that we can help the many patients that are having chronic pain.
Without the ability to perform a physical exam, how are you adapting your diagnostic approach to ensure you're providing safe and accurate care?
I am asking the patients that have particular problems, if I feel they need an examination, then those patients will need to go and see either their own healthcare provider or go and see urgent care or emergency. But surprisingly, many of the problems can be managed through photographs, through a detailed history, and just carefully listening to the patient and following up to make sure that the problem's being resolved.
How has the flexibility of this schedule for you personally given you better career satisfaction?
I love the flexibility. I love the ability to actually have the freedom to design my own day, to also know that if something crops up urgently, I can contact the medical office assistants and they'll be able to shift my appointments and make sure that the patients get seen by other doctors. So I don't feel I'm letting the patients down, because there's this continuity of care, there's the good notes that are there in the files, and the patients can shift seamlessly from one doctor to another doctor.
Can you describe a situation where you had to navigate a challenging case virtually and how the platform supported you in managing it?
Well, I'd like to say that what's made a big difference to me is the understanding that Avy has insisted that we be as tolerant as we can possibly be towards patients. There's this understanding that patients are under a lot of stress, that when they're ill, and especially when they don't have a personal physician or nurse practitioner, they're feeling nervous about the healthcare. And Avy has asked us to be tolerant of patients that are maybe a little emotionally dysregulated because of the stress and anxiety they're having, and we're asked to give the patient space. So that's for me something that I really appreciate with Avy, that there's this attitude towards allow the patients to have a space and respect them. And sometimes if we don't manage to have a very good conversation, we don't say to the patient, we're not going to talk to you anymore. We just give them space and tell them to call back later.
What advice would you give to another physician who might be skeptical about the effectiveness of telemedicine?
I would tell them that until they try it, they won't know how good it is. Because when we're looking at how we're looking after patients and how much we can manage, from pap smears to colon cancer screening to mammograms, we can manage so much more than people expect, and we can provide them with chronic disease management as well as acute care.
How seamless is the process of coordinating with pharmacies or issuing lab requisitions through the Avy system?
Oh yeah, I love that part. I love the way the pharmacists are becoming part of community of care. So the pharmacists become involved with the patient care. They'll send us messages, they'll make appointments for the patients. If the patients aren't very good with the computer, they'll actually let us send lab forms and everything to the pharmacy, and the patients can manage to access all the forms from the pharmacies. So it's feeling like we have community care, not just the healthcare provider from Avy, but the pharmacies, and even in facilities, we have the facility members contacting Avy, and we're working with facilities, family members, and the patients in a proper way.
In a day, could you potentially hit every part of the province with the patients that you encounter?
Oh yeah, absolutely. That's the beauty. I can pick up the phone and phone somebody in the furthest reaches of BC, in rural areas, and I can speak to anybody, even in the workplace or in any place.
How many different areas do you hit in a day? Like, could you hit like 100 Mile House? Could you hit like Surrey all in the same day?
Oh yes, I've seen patients from far north and patients on the island. So I've got patients from all over BC, and which is nice. I've actually worked in the north, so it's quite fun talking to people in the north because I know exactly where they are, where they're situated, and the difficulties that they have in certain areas where there's even more difficult areas of access.
Do you see telemedicine as the future?
Well, I think it's here. I don't think it's the future. I think telemedicine is here to stay. And I think just as doctors working physically and nurse practitioners working physically are here to stay, I think telemedicine is a very vital part of our healthcare system now.
Do you feel that you're alleviating the bottleneck of trying to find a family physician?
More than that, we're also relieving the pressure from the family doctors who can't see their patients in the next week or 2 weeks or 3 weeks. And this is alleviating stress from the patients. Even when patients have a healthcare provider, they can't gain access when they need to. They can come and see us, and then we will refer the patient back to the healthcare provider and also copy results and investigations to the healthcare provider.
And how about alleviating the ERs? Because, you know, often you find patients just are like, I'm going to go to the ER.
Yeah.
Maybe I have a sick kid.
Yeah, I think we've done a huge job in not only saving money, but also relieving stress and preventing additional costs for the healthcare system by preventing people that don't need to be sitting in an emergency room and clogging up the emergency room. We're also allowing the nurses and doctors there to work more effectively because they can see the patients that really need to be seen quickly.
Amazing. That's all I had. Thank you.